So I discovered psychodrama on my clinical internship year as I was getting my doctorate degree in clinical psychology. And I found it so fascinating that we got to act out different scenarios and we had a chance to talk to different parts of ourselves. And I thought I need to find out more about this. And so I was studying in Chicago. When I went back to Chicago, I found Lorelei Goldman, Elaine Sacknoff, and I started going to psychodrama trainings, and it changed my life. It was so powerful, and I started training more in it, and I realized that it really helps patients get deeper than traditional talk therapy can. And so that started a whole journey where I went to see John Raspberry and then to Hudson Valley Psychodrama Institute with Rebecca Walters and Judy Swallow, and I started on this process of just learning more and more about psychodrama and then really starting to use it with patients.
How has it changed your life as much as you want to,
Yeah, I mean, I've seen changes in everyone, but especially myself. It's an experiential method, and so you learn by doing, but I have found so much healing myself in the service of training, and things that I just never imagined could shift. I found new ways of thinking about things and new ways of acting and just being with myself through psychodrama that I don't think I would have found in any other method.
What are you most proud of in your career?
So first, I'm most proud of getting my doctorate degree. That was a long journey. But second, I'm most proud of getting certified as a psychodramatist and starting groups and really getting people excited about it in Chicago. And I've had a psychodrama training track at a medical center that I worked at in Chicago. And new graduate students who've never been exposed to psychodrama are now getting exposed to it again. And they're getting excited about it. And they're seeing how much it helps their patients and the people that they work with, and how much further they can get than just traditional therapy when we put things into action. And that I am so proud of, that I get to help people every day with this method.
Wonderful. Tell us a little bit about how long you've been doing this and a member of ASGPP and coming to conferences.
Yeah, so I first found psychodrama in 2009, and then I really started getting more serious about it in 2011, and that's when I came to my first conference, and then that started all my sort of intensive training, and then I've been a member of ASGPP since, and for the last 3 years I've gotten to present at the conference as well, and that's been really new and exciting.
So what was your experience about the conferences and the ASGP, and then, eventually presenting yourself, presenting workshops?
So these conferences are so much different than other mental health conferences. Traditionally, especially with psychologists, we go to conferences and we sit, and it's about sort of our role as a professional psychologist, and then just learning about the patient and how to help the patient. And it's just a very different feeling. You're more just, you're studying, and it's a little bit more rigid. These conferences are a little bit more playful, and because they're experiential, you actually get to experience how these methods work with people, and that I think is very powerful. So they're fun, and you meet such a nice community of people. The psychodramatists are some of the nicest people I think I've encountered, and it's just been such a loving and wonderful experience to just be with like-minded people who are really using their creativity to help people.
And what would you tell somebody that's beginning to be interested in psychodrama? Would you suggest conferences? What would you say? What would you tell them?
So I always try to encourage people to go to a local training first. Psychodrama is something that's hard to explain. It's hard to talk about, and I always tell people you have to see it, because I just can't do it service trying to describe it. But I think once they go and they actually experience it and they see it in action and they see how it can be used and how so many of the different theories of psychology fit so nicely into it, then they, I think, have a realization of this is very powerful. So I always tell them you have to just experience it.
What are you working on now in your career, doing psychodrama, your growing edge? Where are you now?
So right now I lead psychodrama groups for adults, and then I just started a training center in Chicago, the Chicago Center for Psychodrama, and I offer 1-day and 2-day weekend trainings, and so I'm trying to get, again, that excitement in Chicago and the surrounding area for psychodrama so that more people can see what this is all about. So my goal is that hopefully with the help of other people that Chicago one day will be a main hub for psychodrama.
What would your hope and dream be for psychodrama in general?
I want psychodrama to grow. I think that, it had its heyday back in the 60s and 70s, and then when more protocol-based therapies with cognitive behavioral therapy and the sort of push towards evidence-based treatments, psychodrama kind of fell to the back burner and people stopped talking about it as much. And my hope is that we can bring it back again, that we can reignite the passion around it, because again, so many things fit into psychodrama, and when you do it, it's a different way. So for someone who does CBT, cognitive behavioral therapy, instead of just giving a patient a thought record and having them write down the thoughts and the feelings and what was going on at the time, you can actually put it into action and have them become that thought and have a dialogue with themselves, have a dialogue with their anxiety. And it's such a different experience. And so my hope is that we can get people from all different orientations to come and witness and see how helpful this can be, no matter what their orientation is.
And if you role reversed with either J.L. Moreno or Zerka Moreno, what recommendations would you have for the community?
So if I were Moreno, that's a hard one. He's a powerful guy, and such a presence. I think I would tell people to continue with their passion for psychodrama, continue spreading the word, but we have to create a new cultural conserve. We have to use our creativity. We can't let psychodrama be stale, and so we need to move forward with the times. We need to do more research. We need to get psychologists and other researchers in there who that is their role, doing research, and we need to start showing that it works, because it does, but we have to find a way to study it so that we can let other people know and really give it the credit that it needs to survive. And we need to not be afraid to speak up. We need to speak our truth and speak about what we're passionate about. And then speaking as myself again, I just want to say Moreno, he was a risk taker. When people told him that he had to treat patients a certain way, he said, no, I'm going to treat them the way I want, and he opened up his own psych hospital. And I've always found that to be so powerful, because he didn't let people tell him no. Like, even back then there were these restrictions about how we have to treat patients, and he said, no, I'm not doing it that way. And I think that's important today with insurance companies and managed care, and how there's pressure on clinicians to limit sessions, get people treated quicker, and to say, look, we need to actually educate the insurance companies about treatments and treatments that work.
What would you like to have as your legacy? I know you're in the beginning of your career,
Yeah.
but what would you like to have the direction of your career be as far as psychodrama?
Yeah, I think about that sometimes when I'm at the awards ceremony and I'm watching people win their awards, and I think about how one day I want to be, like an 85-year-old woman, and that people will say, oh, Dr. Lakin-Starr, she really started psychodrama in Chicago, and now there's all these psychodramatists, and that's what I want to be remembered for that passion about spreading the word about this method and providing really excellent patient care.
And is there anything else you'd like to say about psychodrama or the ASGPP?
Yeah, I would say if you're watching this video and you have not tried psychodrama, to look for some psychodrama trainings near you, and just take a risk, kind of step outside your comfort zone and try something experiential and powerful, and just try it and see what it does.
Right? Yeah.
Good, very good.
Thank you.